Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome again to our video series for both students and parents. If we can be of assistance here, please give us a call at area code 775-359-7111. Please remember that these videos are intended to educate you, but not replace visits with your physician. If you have questions, we're happy to see you same day here in our office, but we really can't answer things over the phone about patients we don't know. Today what we'd like to talk about is the difference between developmental screening, developmental surveillance, and developmental testing, because there is a significant difference between these three. So we'll start with developmental surveillance. Developmental surveillance is accomplished when your physician asks things such as, you're here for a 6-month well visit today, is your child walking? Is your child sitting up? Is your child reaching for toys in the midline? Can your child pass a toy back and forth between both hands? Is your child smiling? Is your child babbling? Does your child respond to you when you talk to them? How old were they when they sat up? How old were they when they first tried to crawl? That's all developmental surveillance. And there is a role for that for frequent monitoring, but it's very nonspecific. It's not statistically validated, it is not age normed, and quite honestly misses a lot of developmental delay. To that end, it's not recommended that you do very much in the way of developmental surveillance. The American Academy of Pediatrics recommends well visits at 2 weeks, 2 months, 4, 6, 9, 12, 15, 18, 24, 30, and 36 months. And they recommend developmental surveillance in the first year of life 4 times. I'm sorry, developmental screening 4 times in the first year of life. And then it's an additional 4 or 5 times over the next year of life as well. That, as opposed to surveillance for the intervening visits is okay, but screening to be done on a regular basis. So what is developmental screening? Developmental screening involves using specific tools that have been tested and proven to be of value. So there's statistical validation, to put it in scientific terms, for this. And the most common ones that we use for development for children are Ages and Stages questionnaire and the PEDS questionnaire. And again, those are age-normed, statistically validated, and individually administered. They're designed to be answered by the parents, scored by the physician or his staff. When we do this, I have a number of parents who don't value it for what it's worth. They say, oh, that silly questionnaire you gave me. Oh, that silly questionnaire, hundreds of thousands of dollars went into developing, and I didn't develop it, somebody else did. But it had to be developed, it had to be tested, it had to be proven, over and over and over again by other groups before it could be adopted. So it's been proven to be of value. Screening's goal when it comes to developmental screening is to not miss anybody who is developmentally delayed. It's not to make a specific diagnosis, it's not to make an accurate diagnosis. It's to not miss anybody. So the goal of these tests and the threshold for failing these tests are set such that we don't miss anybody. What does that mean? It means we do overcall a certain amount of developmental delay based off these screening tools. Why do we do that? Well, I would rather worry a parent and get the child developmentally tested and into therapy if that's what he needs early on, or be told you're normal, don't worry about it, than miss a child. Because that child who's missed is a missed opportunity, and if they're not picked up until 1st or 2nd grade, the ability to do effective interventions is decreased rather dramatically, so you have to pick them up early. So again, the goal is to have a very low threshold and to pick up lots of kids and send them for testing, or test them yourself if the office is appropriate for that. So that then brings us on to developmental testing. Testing is also statistically validated, it's age norm, but now it's administered by a trained professional who knows how to administer the specific test. And you have to be trained on the individual tool that you're using. The 2 most common tools that are used are the Bailey and Giselle's. which are developmental assessment scales. They take roughly an hour, 2 hours to administer, so they're very lengthy. You have to be master's prepared or greater to be able to do it. Most pediatricians, myself included, although we're very familiar with these tests, are actually not trained on administering these tools, so we're not really appropriate to administer the tools. Most developmental pediatricians are trained on it. They may or may not actually administer the tool themselves. They may many times have a therapist who is also trained on it who will administer the tool for their office, and it's very lengthy. These tools are expensive and they're very time consuming. They are, however, very precise and currently the best tools that we have available. Based off that, we can then decide what therapies we need for your child or what would be most appropriate for your child. So again, there's 3 kind of levels of testing, of evaluation. The most basic being the surveillance, which is of value but does not replace screening. Screening is what we do in the pediatrician's office, or what should be being done in your pediatrician's office. If your child is not being developmentally screened, demand that they be developmentally screened at the minimum according to the American Academy of Pediatrics Bright Future Guidelines. And if they are being screened, thank your doctor for it. If your child screens positive, the next step is the definitive testing, which is much more involved and a little bit more expensive. But again, important because we don't want to miss these children. Early intervention for these disorders is key. So I hope this has helped kind of demystify what's going on in your doctor's office and some of the therapist's office if your child's going for developmental testing. And if we can be of any assistance here, give us a call at area code 775-359-7111. We'll talk to you next time.